In this video, we'll be discussing shigellosis or Shigella infections. So she likes pink, okay? So girls like pink, she likes pink, so it is gram negative. She is short, so non-motile, non-encapsulated and non-sporing bacilli are seen. Okay, so Shigella is the most important agent of bacillary dysentery. It is named after Japanese microbiologist Kiyoshi Shiga, who isolated the first member, Shigella dysenteriae serotype 1. Which has many exceptions in the biochemical reactions. We'll talk about that. Shigella bacillus from epidemic dysentery. So based on a combination of biochemical and serological characteristics based on the O antigen, Shigella are classified into 4 species. So remember this by the mnemonic dysenteric, flex, boy, son. So dysenteria, flexneri, boydii and sonnei. Okay, so again, based on the O antigen, each species is further subdivided into several serotypes. So 15, 8, 19 and only one serotype in Sonnei, but it has further 26 colchicine types. So pathogenesis, Shigella is the most important cause of bacillary dysentery. So mode of transmission is by contaminated fingers, most common, food, water, rarely flies, and also rarely by sexual transmissions, sexual contact in homosexuals. So minimum infective dose is very low, as low as 10 to 100 bacilli, that's it. Probably because of their ability to survive in gastric acidity. So pathogenesis, remember this, M. IPA, secretory ICSA. Okay, so entries via the M cell. Then invasion is determined by a large virulence plasmid which codes for IPA proteins, IPA proteins and type 3 secretion system. Okay, so M. IPA secretory. Okay, IPA proteins, IPA secretory. Remember this, IPA protein secretory system, and also direct cell to cell spread. Cell spread is by ICSA. Okay, IPA secretory, IPA secretory, ICSA. IPA secretory, ICSA. So exotoxins, Shigella and endotoxins. You have endotoxin, which is the same thing. Exotoxins, you have Shigella enterotoxin and Shiga toxin. Next, clinical manifestations, it evolves through 5 phases. Incubation period 1 to 4 days. Initial phase, there is watery diarrhea with fever, malaise, etc. Phase of dysentery is seen, bacillary dysentery. So frequent passage of bloody, mucopurulent stools with increased tenesmus and abdominal cramps. Okay, then there's the phase of complication, which is seen in children with less than 5 years of age. So intestinal complications, metabolic complications, and Akiri syndrome or toxic encephalopathy. And finally, there's a post-infectious phase where there is autoimmune reaction within months after shigellosis. So patients express HLA B27. So what are the risk factors? Under 5 children, because the 4th step phase of complication, intestinal, metabolic, and Akiri syndrome are seen there. And also overcrowding and poor hygiene. It tends to occur as epidemics in developing countries in the Indian subcontinent and sub-Saharan Africa. So basically, S. flexneri has the maximum number of cases in developing areas including India. Developed countries like to hear sonnets, right? So sonne is more prevalent in developed countries. Cases caused by S. dysentery type 1 are associated with high mortality. It usually causes epidemics of dysentery, particularly in refugee camps. So humans are the natural host and cases are the only source of infection. So in the world, shigellosis is the most communicable important disease among bacterial causes of diarrhea. Okay, children less than 5 years of age account for nearly 69% of cases. Lab diagnosis, rectal swabs are not satisfactory. We need the fresh stool as the ideal specimen. So specimens should be transported immediately or sent in transport media, which is Sachs buffered glycerol saline, buffered glycerol saline. Okay, BGS, big stool, fresh stool, buffered glycerol saline. Next, wet mount preparation of feces shows mucopurulent bloody discharge rate. So bloody RBC, purulent, you have pus cells and also macrophages. So lab diagnosis, to inhibit the commensals, you inoculate the fecal specimen simultaneously into enrichment broth as well as selective media. So enrichment broth, you use selenite F broth, tetrathionate broth and gram-negative broth because it is gram-negative. And selective media, you use mildly selective McConkey agar, highly selective DCA and XLD agar. And again, gram staining, you can see short gram-negative bacilli. They're non-motile, non-capsulated and non-sporing. Identification, you can use Vitek. Malditoff is not useful for Shigella because it cannot differentiate between E. coli and Shigella. Next, biochemical tests. So she thinks cats are cute. She thinks I am cute. Okay, so she thinks she likes cats, right? So catalase positive, oxidase negative. She thinks I cute. Okay, but it's not true. So all are negative. Indole negative, citrate negative, urease negative, and then at T you have gas negative and H2S negative. It shows alkaline or acid. So all Shigella species like sugar. So she likes sugar, she likes cats. Okay, so sugar, all are mannitol fermenters except dysentery. Okay, again all are catalase positive except dysentery. Next, automated method Malditoff poorly differentiates it from E. coli. Then again, serotyping, colchicine typing as can be done for S. sonnei, and antimicrobial susceptibility testing. So treatment of shigellosis, she likes to sip wine, so ciprofloxacin. Because of prompt transmissibility, current recommendation is that every case of shigellosis should be treated with antibiotics. So what is the treatment? Duration of treatment is about 3 days, but S. dysentery deaths are more, right? 5 days of treatment, and infections in immunocompromised patients, 10 days of treatment. ORS is started for correction of dehydration, and nutrition should be started as soon as possible after the completion of initial rehydration. And again, hand washing after handling of children's feces before handling of food is highly recommended. Stool decontamination with sodium hypochlorite has been proven useful. No vaccine is currently available, although several clinical trials are currently being conducted.